So I think this is one of the most important studies that has been reported in AML in the recent years. We've had a lot of exciting reporting in AML with various strategies, as I mentioned, IDH inhibitors, FLT3 inhibitors, as well as venetoclax and hypomethylated combinations. But this study is also very exciting because it is the first time ever that any agent has shown improvement in overall survival as well as relapse-free survival in the maintenance setting in AML. Maintenance has been a strategy that we have used in various hematological cancers. We have done it in ALL for several decades. We have tried it in AML, but unfortunately in AML we have not had the convenient drugs that can be taken relatively safely and with ease when the patient is in remission. So this drug, CC486, which is an oral hypomethylating agent, was evaluated in this large randomized study of about 460 patients. These patients were over the age of 55 and had received induction and possibly consolidation, any number of consolidation, after achieving a complete remission to traditional induction therapy. And they had to be considered not eligible for an allogeneic stem cell transplant in first remission for whatever reason the practicing physician decided. And they had to be randomized within 4 months of achieving complete remission. So the patients could have either de novo or secondary AML, and they had to have either adverse or intermediate risk cytogenetic classification. And they were randomized 1-to-1 to receive either oral CC486, 300 milligrams daily for 2 weeks, or oral placebo. And the patients would be monitored with bone marrow exams every 3 months for possibility of relapse, and they would be followed up until relapse or death. Now, patients who were found to have early relapse with bone marrow or peripheral blood blasts up to 15% had an option of increasing the duration of CC486 or placebo therapy to 3 weeks. And overall, about 15 to 20% of patients did actually do this. So the reason why the study is highly significant is, as I mentioned, it is the first ever study that showed that this strategy using oral CC486 significantly improved relapse-free and overall survival as compared to the control arm, which received placebo. Also important is that this drug was relatively well tolerated. Of course, CC486 is a active drug. Because of this, there was more GI toxicity, such as nausea, vomiting, and diarrhea in the patients who received it. But also there was more neutropenia and thrombocytopenia in the CC486 treated patients. However, the percentage of patients who had to stop therapy because of side effects was very low. And the other important thing that was done in the study was looking at quality of life with the standard quality of life measures, and there was no difference between patients on the CC486 arm and placebo in terms of quality of life. So again, this has been a very important study. It took about 4 or 5 years to continue, and it was extremely well done with collection of information as well as samples throughout this period. There's another part of the study that hopefully will come out soon, and that's patients had minimal residual disease assessment by flow cytometry, and this will be very instructive because it was done throughout the study in all patients. and we will likely learn a lot more about MRD eradication after this data becomes available. The follow-up presentations in ASCO and EHA are looking at subpopulations as well as quality of life measures. And for example, there is one presentation that's look at the patients who had the escalation in number of days of CC486, and also one presentation which is looking at specifically patients over the age of 75 who were randomized in the study. There were a limited number of patients, but essentially in patients over 75, there was also a significant benefit from use of CC486 without any significantly higher toxicity of the agent.